Welcome to this introduction to epidemiology, part of our study of preventive and social medicine. Over the next few minutes, we'll build a complete picture of epidemiology, its core concepts, how it's measured, the methods epidemiologists use, and how disease actually spreads from person to person. This lecture is based on Park's textbook of preventive and social medicine, a standard reference in the field.
Let's begin with Part 1, Concepts and Definition. We'll ask what epidemiology is, unpack its definition and key terms, look at its three components, and finish with its aims. Slide 4, What is epidemiology? The word epidemiology comes from three Greek roots, epi. Let's begin with Part 1, Concepts and Definition. We'll ask what epidemiology is, unpack its definition and key terms, look at its three components, and finish with its aims. Slide 4, What is epidemiology? The word epidemiology comes from three Greek roots, epi, meaning upon or among, demos, meaning people, and logos, meaning the study of. Put together, it literally means the study of what befalls a population. Originally, epidemiology focused only on epidemics of communicable disease. Today, it embraces all diseases, conditions, and health-related events, and it's regarded as the basic science of public health and preventive medicine. Slide 5, Defining epidemiology. How exactly is epidemiology defined? The most widely accepted definition comes from John M. Last in 1988. Epidemiology is the study of the distribution and determinants of health-related states or events in specified populations, and the application of this study to the control of health problems. Earlier definitions were narrower. In 1927, W. H. Frost described it simply as the science of the mass phenomena of infectious diseases. In 1934, Greenwood called it the study of disease, any disease, as a mass phenomenon. Notice the shift. Those earlier definitions were limited to infectious disease, while Last's definition widened the scope to cover all health-related events. Slide 6, Unpacking the definition distribution, refers to the frequency and pattern of health events by time, place, and person. Determinants are the physical, biological, social, cultural, and behavioral factors that influence health. Health-related states or events cover diseases, causes of death, behaviors, and the provision and use of health services. Specified populations means the epidemiologist studies groups, not individuals, groups with identifiable characteristics. And application to control reminds us that epidemiology isn't only descriptive, it's a means to an end, the prevention and control of health problems. Slide 7, Three components of epidemiology. Epidemiology rests on three components. Disease frequency means measuring how much disease, disability, or death occurs, expressed as rates, ratios, and proportions. Distribution is the pattern of disease by time, place, and person. This is descriptive epidemiology. And determinants are the causes and risk factors of disease, which we test using analytical epidemiology. Slide 8, Aims of epidemiology. Epidemiology has three specific aims. First, to describe the distribution and magnitude of health and disease problems in human populations. Second, to identify the etiological factors, the risk factors, in the pathogenesis of disease. And third, to provide the data essential for planning, implementing, and evaluating services for prevention, control, and treatment, and for setting priorities. Underlying all three is one ultimate aim: to lead to effective action, to prevent disease and promote health. Slide 9, Approach, Measurement, and Uses. Now to Part 2, Approach, Measurement, and Uses. We'll look at the epidemiological approach itself, how measurement works in epidemiology, the crucial distinction between incidence and prevalence, and finally the scope, the many uses of epidemiology. Slide 10, The Epidemiological Approach. The epidemiological approach rests on two basic procedures. The first is asking questions about the health event itself. What is the problem? What's its magnitude? Where, when, and in whom does it occur, and why? And about the health action. What can be done to reduce the problem, and how can it be prevented in future? The second procedure is making comparisons. The epidemiologist compares groups, say, people with and without a disease, or with and without a particular exposure. These comparisons reveal the crucial differences that point toward causes and risk factors. Comparison groups lead to exposure, which leads to risk. Slide 11. Measurement in epidemiology. Epidemiology is fundamentally a quantitative science. It's concerned with measuring mortality, deaths, morbidity, the incidence and prevalence of disease, disability, the presence, absence, and distribution of characteristics in a population, and medical needs and the use of health services. To do this, epidemiologists rely on three tools: rates, ratios, and proportions. All three rest on counting and quantification, and remember, a rate always needs both a numerator and a denominator. Two measures are fundamental here. Incidence is the number of new cases occurring in a defined population during a specified period, calculated as the number of new cases in that period, divided by the population at risk times 1,000.